And now on the line is Fiona Murphy, a senior project worker with Tallaght Addiction Support Project, or TASP. Fiona, welcome to the programme.
Hi Darren, thanks very much for having me today.
Okay, Fiona, I got in touch with Grace Hill, the coordinator of the Tallaght Drug and Alcohol Task Force, last week to arrange an interview with her about the recent task force report brought out on at the start of the month in Tallaght.
Sure.
Anyway, Grace was already scheduled to speak on another programme on Near FM earlier this week, and she put me in touch with you, as I said to her I was particularly interested in talking to a project worker in your parts of the country, in part because I can also myself talk about a couple of addictions from personal experience. Can you start off, Fiona, by telling our listeners on Near FM a bit about who TASP are and a bit about the change and evolution of your work since the organisation was founded?
Sure, no problem. So we're a fairly new organisation. We were set up about a year ago. So we are a methadone prescribing clinic, and we also provide community alcohol program, and we do a lot of counselling, key working, and we will be setting up a number of groups for cocaine in the new year. So what we are finding in our service over the last year, is a huge increase in polydrug use. We have a lot of clients who attend our service who will be stable on methadone. And then we have some clients who would also use crack cocaine. Crack cocaine is huge in our area at the moment. So we have a number of clients who would be using crack on a daily basis. And we have seen the deterioration in these clients, over the last number of months as a result of their crack cocaine use. We would also then have a lot of people being referred to us from Tallaght Hospital in relation to alcohol use. So our referrals have increased tenfold for people looking for support for alcohol. We also then would have a number of young people, young men who would be looking for support for powder cocaine as well. So, and also cannabis as well. So we would meet a number of we would cater our needs for a number of different drugs that are being presented to our service.
Okay, I believe the report published earlier in the month by the Tallaght Task Force, most of the coverage in the media I saw about was about crack cocaine. Am I right in saying that there is maybe another part or parts of Tallaght that your organisation don't cover, but that have a much bigger problem with crack cocaine?
Well, crack cocaine is prevalent in all areas of Tallaght. It's across the board. It's affecting nearly every community in Tallaght. So, services are trying to adapt to meet this cohort of clients. But, the resources, we're very limited in what we can do to meet the needs of these people.
Okay. It's just one of the figures I saw covered in the media last week about the report. I didn't read the report now, but I read media coverage about it. But I believe Jobstown in particular has a big problem with it, does it?
It does indeed, yeah, Jobstown. But it's as I said, it's across all areas. But we have two projects that were set up here in Tallaght. So it was JAD and CARP in Killinarden. And they have been part funded by the task force since 2018 to provide supports to individuals who were reporting problematic crack cocaine use. So, the need for a specialist intervention was identified from the prevalence data from CARP's administration of crack cocaine pipes from mid-2018 onwards. Their numbers then, by the end of, I think it was August 2021, had surpassed those for 2020, So the use of crack cocaine pipes mitigates, the risk of overdose associated with homemade pipes and other unsafe equipment. So their program for women then, the CARPS program for women, it incorporates an evidence-based approach in a non-judgmental environment to support, I think it's 25 women with problematic crack cocaine use. That's CARP in Killinarden. And then JAD, their program, 30% of their program were female as well, so there's a lot of prevalence amongst females who are using the crack cocaine.
I listened to the interview Grace did with one of my colleagues on Near FM earlier on the week. They talked in particular about crack cocaine, and they talked about the lack of funding for not just the Tallaght task forces, but all the task forces across the country, Am I right in saying that, Fiona, going by the trajectory crack cocaine is on in some parts of Dublin, that there's a real likelihood that the crack cocaine addiction issue and related problems could well cause as much and even more devastation as the height of the heroin problem we had in the 1980s and 1990s?
Well, I would definitely agree. It's the deprivation that it's causing, to communities. It's visible in communities. There's increased begging. There's a detrimental impact on local communities. There's public order, there's intimidation, dealing, violence, physical health, child welfare, and forced prostitution. So, the harms associated with crack are much greater than what the heroin epidemic would have caused, and to work with people in crack cocaine, you need a much broader, specialised kind of intervention to work with the people who are using crack cocaine. So, there's much more interagency work needed. So I would imagine that, the deprivation, that the harms caused by crack is much more prevalent than that of heroin, or it's along the same lines.
And on the interview I listened to Grace, the podcast with Grace talking to Donny on Near FM at the beginning of the week, she was saying that the task force in Tallaght need €1 million extra funding next year, and but she was talking as well, like every, I believe, task force, drug and alcohol task force in the country, I believe these were set up in 1997, all the task forces, and since then there hasn't been one government who have funded this adequately. Do you agree with that?
I would agree with it, Jess. In 2010 there was 1.3 million allocated to the Tallaght Drug and Alcohol Task Force, and in 2020 it was 1.2 million. So it's a 5.5% reduction. And the population has grown, there's urban sprawl, there's increased prevalence of substance misuse, and inflation then of 10.7%. So services are being continuously challenged to do more with the same level of resources, So definitely there is a greater need for much more funding, as Grace has mentioned.
Okay, we haven't got the time to discuss all of your work and tasks in depth in this interview, Fiona. But cannabis or weed addiction is a huge issue, particularly, I believe, amongst young people across the country, isn't it?
It is indeed, yeah, definitely.
Go ahead.
So, I think in our area, cannabis was the number one drug that's mentioned in the report, and then crack, and then powder cocaine. So they're the three main problem drugs, followed then by alcohol and nitrous oxide and benzos.
I was talking to a child and adolescent psychiatrist last week, Dr. Bobby Smith. You probably know him. I think
I do, in Yoda.
Yeah, I don't know Yoda, but he was telling me that across every task force area in the country, amongst under 25 years of age, cannabis is the number one drug that's driving addiction, places for addiction treatment. Across across the whole country. I think it's incredible, because the whole weed situation has changed hugely, I believe, over the decades. I smoked it when I was a teenager fairly regularly, And
Sure.
looking back on it, I was addicted to it. But I'm off. That was 20 years ago. But like
Brilliant.
when I smoked 20 years ago, it was hash. It was the brown kind of stuff, you know. But
Yeah.
nowadays, I believe it's marijuana or weed, and it's a lot stronger. And am I right in saying it's a lot more addictive, also in the sense that you can do it only a few times and you get addicted to, or what's the story? Do you know?
Well, what I do know is that the THC levels have increased. You know, I think years ago it would have been probably about 6%, and I think it's up somewhere in around the 30%. And it's the THC then that does the harm. So in terms of it being more addictable, most definitely with the THC levels being so high, I'm sure that's what is causing the more addiction, you know. And I have heard from other areas, you know, that sometimes it has been sprayed with heroin. There was one service where a friend of mine was working, and she had mentioned that when they were given urines to lads who were coming in for support for weed addiction, there were opiates in their system and they hadn't taken any opiates. So the only thing that they could come up with was that it had been sprayed with heroin. Or now I don't know how true that is, whether that was the case, but that was what was reported to me from another area. So
I won't be surprised in the slightest if it's true. I have heard that the weed nowadays is mixed with what is it? It's kind of, I'm not sure what the drug is, but I have heard a description that like if you smoke weed nowadays, often it's like going on an acid trip or something, because like to an extent, because it's mixed with other stuff, you know. I'm not sure exactly what else, but I wouldn't be surprised. Even when I was a teenager, I did ecstasy for a year or two as well, and there was one ecstasy at the time, and it was speckled with heroin. Like it was only a tiny, yeah. I'm not sure what drug, which one in particular it was, but it was only like it, it was only slightly speckled with it, but that did happen back then, and I assume it happens now.
and now, yeah.
Okay, drugs, including alcohol, Fiona, like they do a lot of damage, don't they?
Absolutely, you know, especially, you know, alcohol, you know, it's so deeply ingrained in Irish life, you know, that it pervades every aspect of our culture and our daily lives. You know, it's a societal and a complex issue. And it's part of everyday normal life. But I mean, even the drug issue has become so normalised in our communities that people have stopped noticing it because it's a normal part of our lives here in our communities across Tallaght.
Just to talk a bit about alcohol for a minute, I've been covering the whole process of the Public Health Alcohol Act getting brought in, and now it's in, and it's mostly implemented. It's not implemented fully, but would you be a big supporter of that legislation?
Well, I would. I don't. You know, I do. That's a tricky question because I would be a supporter of it, you know, but as you said, you know, part of it has been enacted, but it's how do we police the public health alcohol bill, the pieces that have been enacted. You know, I wonder, is it being policed by the government enough? You know, are there task forces out there who are able to say, well, such and such a shop isn't enacting the public health alcohol bill, you know, they're not complying. So,
okay, I was actually in touch with Alcohol Action Ireland in a personal capacity, not for an interview, about the implementation of the Act as regards to shops, because basically it's the county council's environmental health officers who police this, you know. So there were two shops near me, and after that part of the Act came in about structural separation, they hadn't implemented it. So I got on to the environmental health officer for my part of Dublin, and she got onto the shops, and within a short space of time, the issue was sorted out, you know.
The issue was sorted, right? Okay.
But I interviewed Ewan McKinney on this issue of Alcohol Action Ireland a few months ago, and he said at
Hmm.
that stage, if they were to give all the shops and supermarkets a grade out of ABC, to give them a C, so there's still a
Yeah,
lot of work to be done. But I
to be
think,
done,
yeah,
definitely.
I think it takes people to uh, get on to their environmental health officers and make a
So,
complaint, and
yeah,
you don't even have
I
to
don't.
you don't even have to give your name to them, like, I mean,
You can
but
just make them aware of the shop
yeah,
that is in
yeah,
compliance.
yeah,
Okay, yeah,
yeah.
okay.
Okay, I was looking at your website in TASP recently, Fiona, and I'm delighted to see that you do some complementary therapies. And I was
Yes,
delighted to find out that one of them was Reiki. I'm attuned to be able to do Reiki for over 20 years, and I don't have a practice now, but it
brilliant.
has had a huge, big positive impact on my life and still does. I did an interview with Addiction Response Crumlin there last year, and they do Reiki as
Right.
well. Do your clients like the Reiki and the other therapies you do?
Yes, well, I mean, I'm only back working with Swan now since last November, so we haven't been able to do any holistic therapies due to the pandemic. But from my previous experience of working in Swan, we would have had a lot of clients who returned on a regular basis for the holistic therapies. So, they were obviously benefiting if they kept coming back,
Mm,
and, you'd see a family member who would have been affected by a loved one's addiction coming in and, kind of walking with their head down. And after a couple of weeks after receiving the holistic therapies, to watch them slowly start to lift their head and to be able to walk out and to start feeling more positive and a little bit stronger in themselves was just powerful to watch.
mm. And can you just tell our listeners on their FM exactly what holistic treatments or complementary therapies you have along with Reiki?
So we would do auricular acupuncture, and we would also provide Indian head massage. There are one or two therapists trained in reflexology. We'd also do the Reiki, and we do a foot and leg massage and a facial massage also.
Is there any particular therapy amongst them that your clients or their families love in particular, do you think?
Well, the auricular acupuncture is really beneficial.
Hmm.
So it's beneficial to people in addiction, but it's also beneficial for stress relief. So it's beneficial across the board. It is said to help with cravings for people in addiction. So auricular acupuncture would be one of the favourites over there. And as I
Okay.
said, since I've been working in TASP for the past year, unfortunately, we haven't been able to provide it because of the pandemic. We can't have that close contact. But at the moment, we're looking to find ways around this so that we can start introducing the holistic therapies again.
Okay. Are you doing your are you carrying out most of your work on Zoom nowadays, or what's the story?
No, not we were last year, so we are very stickler about sticking to the HSE protocols, the guidelines. We ensure that all our clients coming through the door wear a mask. We ask them the COVID questions when they come in. We also, if people are availing of our service, we will ask them that if they have any symptoms, not to come near our service. So we can do some one-to-ones. We have a big group room where we can do some group work. We're limited to the amount of people that we can have in our groups because we have to make sure that the 2 meter distance is enforced. And so now we have been able to work face to face, but we're limited to the amount of people that we can have in the building.
Okay, just to go back a minute, talking about Reiki there, I was saying that I can do it for over 20 years. It's had a huge positive effect on me and still does.
Sure.
But I'm talking there, I don't mean simply just the whole relaxation part of it, but
Mm-hmm.
about personal and spiritual growth. It's really helped me, I think it's brilliant. Okay, Fiona, to come towards the end of the interview, is there anything else you want to tell our listeners on Near FM about the future and direction of your work in TASP, taking into account the current trajectory of drug use in Ireland?
I just think that we definitely need an increase of funding for all the services across the communities in Tallaght. We, as I said, we're very limited in what we can provide, even though all the services are providing an excellent service. I just think that we would like to be able to do more to help the people who are using substances. But as I said, then we're limited in what we can provide with the resources that we have. There's an over-reliance on CE staff. We depend greatly on CE staff, which is an awful shame, because CE workers, if you find one that's really good, after 3 years and you've invested in them, you've given them the training, then there isn't an opportunity for them to be able to stay on and work in your project. They go elsewhere and another service benefits from the work that they have done. So I just think that there needs to be probably some sort of a way to be able to retain CE workers as much as possible, but also then to be able to increase the workforce by employing extra employees in the workforce.